Hi, it's Vero here from Podiatry Services SA. We treat lots of athletes here, and one of the most common injuries that we see is heel pain. Now, heel pain is associated with all sorts of factors, but the primary one is what age the patient is. Now, if there's growth still happening, obviously for a child, we need to consider treatment in a particular way, as opposed to an athlete that's already had their growth and they're a lot more set in their ways and also in their bodies. With kids, we need to consider how much stress is going through the heel, so the loads that are going through them, number one. Number two, we need to consider how much activity they're participating in. And also number three, what sort of mechanical changes are associated with their feet and their legs. So loads, mechanics, and also activity is something that we need to consider. Also, when treating our elite athletes, as well as our amateur players, we need to consider the same factors. Obviously, growth is not such a concern, but we need to consider surfaces we're playing on, shoot and boot selection, training schedules, but also importantly, probably the most important factor is loads that are going through that tissue. So rehabilitation of an injured tissue is really important, but prevention is the key. So if in doubt, we can assess how you're training, what you're training on, and how much treatment if you require anything at all.